Thank you all for coming. Thank you everybody for joining online. I'm Whitney Hall. I'm a dairy specialist with UVM Extension, and we're really grateful for Dr. Buckley for coming to spend Valentine's Day with us. So I just wanted to give you a little introduction about why we're here, kind of our role as UVM Extension with goat dairy. So this is our second project with goat dairy. We conducted a survey in partnership with the Northeast Dairy Business Innovation Center as well as Vermont Creamery in 2022. And now we're wrapping up a milk quality project. And so our team, you can see below, so myself and Kelsey Bram are here today. And then I think we have Holly that's joining us virtually as well. So just a little bit about our goat dairy technical assistance and some research that we've conducted here at UVM. This is our second Vermont Goat Dairy project, and this one we were looking at milk quality. So we were really focused on milk quality assessments and technical assistance provided directly to goat dairy farmers. We also are working on a financial calculator tool to help dairy farmers be able to figure out financial benchmarks and cost of production. And we've been conducting regional outreach as well, so workshops and programs like this to connect people from a wide variety of backgrounds. So just a little bit about the project. We had 16 goat dairies enrolled, so about 50% of Vermont's grade A goat dairies. And we had a mix of farmstead creameries as well as those shipping fluid milk to Vermont Creamery. And our participants ranged in size from 14 to 950 milking does. And we partnered with Dr. Paul Verkler of Quality Milk Production Services at Cornell, and we completed on-farm milk testing and parlor audits between December 2024 and August of 2025. We conducted follow-up visits after that where we sat down with the farm as well as Dr. Verkler and presented what we found during that parlor audit. And then we also conducted interviews with these farmers. And so with that, I'm going to turn it over to Dr. Buckley, and she is going to tell you a little bit more about milk quality.
Thanks. All right, thanks, Whitney, and thank you guys all for having me this weekend. It's a lovely weekend here in Burlington for the folks online who couldn't make it in person today. I'm really excited to be able to share some of my insights on improving milk quality in dairy goat production. It's a really nuanced topic, and so I'm just kind of going to cover some basic areas that I've noticed a lot of farmers can make improvements that I expect would change their milk quality relatively quickly, and then there are definitely some other more detailed aspects that we can talk about with the Q&A as people see fit. I don't think that clicker's working. Okay, so today we're going to talk about assessing milk quality on a goat dairy, and then we will kind of focus on the animal side of things, and then we'll talk about the equipment side of things and the different factors associated with each of those components and how they can play into milk quality. And I did try and leave plenty of time for questions as well. So first things first, let's talk about some lactation physiology. So gosh, that mic sounds really loud. I'm sorry. So goats make their milk differently from sheep and cattle. And I think this is really important to understand because when we start talking about benchmarking, there are physiologic differences that do change how we set our benchmarks. So, sorry, some of these words were a little bit blurry, and I tried to create my own labels, and they didn't line up properly. But cows and sheep produce milk mostly through merocrine secretion, where they make all of the components at a cellular level of the milk, and then those components move to the apical membrane of the cell, basically is what we call it. Let's see, can I make this? Nope. That is the part of the cell that is closest to the lumen, where the duct is that is going to take the milk down into the mammary gland. So they spit those components out into the gland, basically, and then they move down through the system of collecting ducts and tubules. In goats, we see more apocrine secretion, where those components are actually packaged up and wrapped inside a part of the cell membrane and then spit out all together in a cute little package. And so those little packages move then through the collecting ducts and tubules, but they are easily mistaken by our automated cell counters as somatic cells. And so we are always going to see an artificial increase in somatic cell counts when we use automated cell counters until the technology kind of catches up with that. But it's really common to see artificial inflation on top of increased numbers due to milk quality. So there's always that little confounding factor to keep in mind. Now, how much of a role this physiology plays in that discrepancy, I think has really yet to be parsed out. But there is certainly some artificial elevation when we're using the standard counters that DHI labs will use, as opposed to if you were to put some milk on a slide and look at it under a microscope and truly determine which of these are cells, nucleated cells, and which are just those vesicles. So in goats, we tend to see a lot more variation based on a couple of different factors. We can see some variation in sheep as well, but in goats, we see changes based on parity, more marked changes based on parity, so how many lactations she's been through. You'll also see a seasonal fluctuation in somatic cell count based on the season or the photo period. So as goats naturally prepare to dry off during the fall and winter months, we're going to see increases in somatic cell count. Even in goats that are undergoing extended lactation, there's not a ton of data out there, but the studies that I could find do show that we will see some small elevations in somatic cell count, even for animals that are not getting ready to dry off. Their milk volume is not dropping, but their somatic cell count is still going to increase a little bit, and then it might drop back down as the days start getting longer. So stage of lactation also plays a role as animals get closer to dry off. The volume of milk decreases and the amount of somatic cells sheds is probably increasing a little bit, but we also have like a dilution effect where they're more concentrated because the volume is less. And so we see a marked increase in somatic cells towards the end of lactation. Housing or management can also play a role, and that could be just causing normal physiologic changes, but could also contribute to pathologic changes within the udder if we're not managing housing properly. Udder health status, again, could contribute to somatic cell count, usually does. Breed, also, we see some variations based on what breed of animal we're milking. I'm sorry, species, that should say species. No, I mean breed. Oh my goodness, it's been a long night. Breed. So are we dealing with Saanens, Nubians, Nigerian dwarfs? We do see some mild fluctuations based on that as well. How long it takes to milk, number of milkings per day can also influence somatic cell count. And then, of course, there's always that individual animal variability. Cool. Okay. Oh, there it is. Okay, so those are all the things that we can see when we are looking at studies on animals specifically. Then when we move into the lab and the Petri dish and the mostly the DHI labs, we can also see changes in somatic cell counting just based on how the milk is handled after it leaves the animal. So the method of analysis, if we're using like a DNA specific counter, you should have lower somatic cell count because the vesicles that goats normally produce don't contain DNA, or certainly not enough to register with a DNA-specific counter. Sample storage temp has also been shown to alter the somatic cell count when you do run it through the standard counters, not the DNA-specific. Preservation method, age of milk at testing, so how long it's been sitting in the tube after it was collected, and then the temperature that the analyzer runs at can all slightly impact the actual somatic cell count. So getting into benchmarking, and sorry for those who were at my talk yesterday, this slide is reused from there, but you'll know it really well. So the Pasteurized Milk Ordinance is the document that dictates regulations for shipping milk across state lines here in the US. It says that any species except goats, the maximum allowable somatic cell count is 750,000. When we're talking about goats for grade A milk, the maximum count is 1 million cells. So here in Vermont, if you were shipping grade B milk, the limit is 1.5 million. And unlike the bovine industry, the bovine dairy industry, where we're nowhere near that maximum of 750,000, unless there's like a really serious problem going on, the dairy goat industry, by and large, producers do get quite close to those maximums, especially towards the end of lactation in the fall and winter as animals get close to dry off. And so how much of this is due to just normal physiology and how much is due to a need for improved milk quality? There are some farms out there that are able to stay well away from that 1 million or 1.5 million limit. And so my belief is that a lot of that elevation is probably due to improvements that we could make in our goat milk quality here in the US. And certainly internationally, farms are able to stay well away from that 1 million mark. So I do think there's a lot of room for improvement, but there's also quite a bit of low-hanging fruit, simple things that we can change that should be able to make a pretty big difference on farms. So we do have to acknowledge that there are fluctuations based on non-health related changes in goats, like we just talked about on the previous slide. But as I said, there are plenty of farms that are able to run around 300,000 somatic cells on a rolling average and produce really, really high quality milk. So it can be done. I'm not saying every farm needs to be at 300,000 on an annual average, but gosh, I really think that we could be aiming to get down closer to like 500,000. And I think that would make a pretty significant improvement. So it is a small industry. We have a lot less data. It's also much less standardized in how we collect that data. So if you're working on a bovine dairy, you are probably using one of like 3 software programs to collect metrics from your herd every day. But goat dairies have a wide range of ways that they collect their information, if they collect it at all. So it's really hard to gauge progress as an industry, but definitely we can assess progress at a farm level. And that's probably the most effective way to drive change. The caveat being, we do need to understand how other farms are doing so that we can understand how much better we can do. Sometimes we just say, oh, well, 1.5 million at dry off is, pretty much what we always have here at our farm. So we figure that's the best we can do. And sometimes it just really helps to say, well, actually someone in California or Wisconsin or New York is drying off around 500,000 or 600,000 cells. And so understanding that other folks can do better might be a little bit more of a motivator for us to do better ourselves. Yeah, I think that's all I want to say about that. So as I said, despite physiologic differences, goat milk doesn't have to max out somatic cell count limits. This mic does sound really loud still. Sorry. All right, so let's talk about things that we can change to improve somatic cell counts on goat dairies and therefore improve our milk quality. So animal-based factors. First things first, we need to be identifying our animals. When I was in practice, I worked in Southern California outside Los Angeles, and I had plenty of clients that milked, 4 or 5 goats, and they knew all of them by name and, knew every detail about them just from memory. And they didn't keep records. But there were certainly times when people had to sell their animals for one reason or another. And a lot of times when they're making that transition, they're moving to a farm that may not know them as well or may not know that animal at all. And so they have no identification. They have no written records of the history because the owner just knew it all from memory. And gosh, that definitely puts the new owner at a disadvantage. So permanent official identification is really important. I think most of us that own animals don't plan for them to, transition ownership unless you're, raising animals, raising young stock for sale. But a lot of goat owners try and keep their animals for their entire productive life. But we should still be planning for the worst where the animal does need to leave the farm someday. So permanent ID is really important. Official identification is really helpful. That can be tricky with goats. They're really good at removing ear tags or leg bands or neck collars. And so I understand there are definitely challenges, but these are not insurmountable challenges. A lot of folks will use neck collars with like ear tags in them for animals that don't tolerate ear tags or can't tolerate ear tags. Permanent records are also really important. Digital records are by and large the preferred method. It doesn't have to be a fancy software program. I know plenty of dairy farms that are making really high quality milk that use Excel spreadsheets, and they can customize those to track the information that they care about. And it's pretty easy to analyze. And so there are a few different options out there, templates that are available. I think what's it called? The Dairy Goat Extension and Education website has a few different templates on there. I should have linked that in the PowerPoint, I'm sorry. But you can, that's a good place to get started, and you can tweak them from there and decide what things you like, what things you don't want, and add anything that's not present. Paper records are okay. It's better to have something written down than not recorded. But things happen all the time. That notebook that my grandpa kept in his pocket when he was, that he would write down details of his animals on every day. Who knows what happened to that notebook? Especially those times when he forgot to take it out of his pocket before grandma put the shirt in the wash. So those records are certainly not as permanent as we would prefer, but it's better to write things down than not record them. There are some farms that record everything on like a blackboard on the wall or a whiteboard or something. I'd really encourage those farms to make a shift into some other more permanent form of record keeping. The minimum data that we want to collect are production metrics. So if we're doing DHI tests, we should be recording that. And DHI makes it really easy because they can send you everything in spreadsheet format if you ask them to. So production volume and somatic cell count, it's always good to have our milk, fat, and protein recorded as well. Reproduction events, so breeding, which sires are we breeding to, what date were they bred? That's going to be really important when we talk about dry period, because if we don't know breeding dates, how on earth do we know when we should be drying this animal or when to expect the animal to kid? And if we're going to be using antibiotics at dry off, then how do we know what kind of withhold period we're looking at? If you do need to have a certain length of dry period to be able to mitigate those antibiotic residues appropriately. So recording reproduction metrics is pretty important, and most folks want to know that anyway. How many kids did she have? How many bucklings? How many doelings? Who survived? Who got sold? I mean, all of this stuff is like things that most producers want to know anyway. Health events, also things that we should be recording. I was really blown away in practice when clients weren't writing this down. They would just say, "Oh yeah, I know that she had pneumonia last year." And then when we started recording things and comparing their recollection to my vet records, I'm like, oh, she actually had pneumonia 3 times last year. Well, that's different. So it's not that people, don't try and their memories are, it's not that anyone's memory isn't sharp. It's just, sometimes our minds play tricks on us. So recording health events is really important. And along with that, we should be recording antibiotic use. Okay. So things like, why did we treat the animal with antibiotics? What drug did we use? How much of that drug did we use? And how many times did we give it? I think I have this in a later slide, but I'm going to say it now anyway, and then we'll reiterate it later. We also need to be recording the withdrawal time. And I always tell people to record the date that they are clean from the withdrawal. So if an animal needs a 5-day milk withhold, on day 6, write that date in the record so that then you can triple check yourself and say, okay, I know I said 5 days. Today plus 5 days is this date. And then on that date, it's a pretty foolproof way to know that the animals should be good to go back in the milking herd. Okay. That's all I'm going to say about that. Another aspect that I think I've seen a lot of, that I have seen a lot of room for improvement on some farms, and some farms do a really great job of this already, but wearing gloves while we're milking. Oh, thanks. Um, So just the milking routine in general, there's a lot of variation on goat dairies, and there's a lot of variation on bovine dairies as well. But wearing gloves, I think I see a lot less of this in dairy goat production for some reason. But it's really essential. Whether you're milking with a machine or you're milking by hand, we should absolutely be wearing gloves. I don't care how many times you wash your hands before you touch your animals. Your fingernails are a great place to collect bacteria. The cracks that form in our hands in this lovely cold winter weather, great for harboring bacteria that is not pathogenic necessarily to us, but if it gets in the udder, it can be a big problem. So wearing gloves, absolutely important. They need to be clean gloves. If your goat poops in the parlor and you catch it in your glove to avoid having to clean it up later, you should take that glove off and put a new glove on instead of going back to prepping your animals or putting machines on. So cleaning, making sure that we have clean holding pens in our holding area and that we're minimizing the time that animals are outside of their pens in general, really important. It's just like bovine dairy production, and I understand a lot of Vermont dairy goat owners are coming from the bovine side, so these concepts shouldn't be new. Udder prep. I've seen a wide range of udder prep. There are some farms that bring animals into the parlor and slap the machines on, and that's it. There are some farms that bring animals into the parlor and they spray the udder down and then they wipe it and then they strip and they spray it again and they wipe and they spray it again, and like it's a 20-step process. So there's a really wide range, but I think keeping it simple is best. We absolutely do need to be prepping the udder before we put the equipment on, even if you don't see visible dirt or feces on the udder. So we should be doing a dry wipe if there is debris on the udder. Excuse me, especially those hairy does in the middle of winter that are bedded on a straw pack. There's going to be straw stuck to the udder. So let's wipe that all off. Do a pre-dip. I prefer iodine or chlorhexidine would be all right. So iodine we want like between 0.5 and 1% for our dip, and then chlorhexidine, a 5% solution is what we're looking for. And these should be products that are specifically formulated as teat dips, not just, whatever you can get at the feed store that's like an iodine tincture. That's going to be too high of a concentration. It's going to be really hard on the skin of the udder. You want something that is made to be used on teats twice a day. It might have an emollient in it this time of year to prevent drying out. Excuse me. But that's really important. I've definitely seen some farms have troubles because of that. Once we've dipped the udder, we want to make sure that we're stripping a couple of squirts, 2, 3, 4 squirts, either into a pail or onto the ground if you milk on a surface that is easily cleaned at the end of milking. If you milk on a wooden milking stand, you need to be stripping milk into a dip cup because you're never going to get that milk out of that wood after it's sat there. And a dip cup is really helpful too because it really lets you take a look at what the milk looks like and determine if there's flakes in the milk or chunks that you might not be able to visibly appreciate if you're just squirting the milk onto the ground. I would really caution people against stripping milk into their palm during milking. If you're trying to check and see if there is an abnormality in the milk, again, you really need to be collecting it in another vessel, or you're going to need to change your gloves before you move on to the next animal. Otherwise, you risk contaminating that next animal if the milk does carry a pathogen. So once we've stripped, and stripping again is a really good time to be checking for abnormalities in the udder. This is how we detect clinical mastitis most of the time in bovine dairy production. So if you're not touching the udder, seeing how the animal reacts to handling, how on earth can you possibly know if she has mastitis until it's like really bad? So we should strip and then wipe, again, a clean towel for every animal, and then you can attach the equipment. Let them milk, and then once they have finished, apply the post-dip and let the girls out of the parlor. Again, we want to maximize the amount of time they spend in their pens, eating, drinking, and lying down comfortably, and minimize the amount of time that they spend in holding pens in the parlor and in return alleys. Another really helpful little pro tip is to refill the feed and water during milking. And this is tricky if you're a one-person show and you're bringing individual animals out onto the milking stand and then giving them grain and then putting them back and bringing someone else out. But if you can, refill the hay while you have all the animals out of the pen and freshen the water. This is a great way to keep the animals up and standing after they are milked, which gives the sphincter, that little guard gate, I'll call it, at the tip of the teat, time to close up before the animals go and lay down. So this is just another layer of protection. Yes, the post-dip is really helpful for this as well, and it's very important, but giving the body's natural defense system time to do what it needs to do by keeping the animals standing before they go lay down on the bedded pack or in the pasture or wherever is a really great way to prevent pathogens from getting from the outside of the animal to the inside of the teats. Okay, somatic cell monitoring is another great way, especially for detecting subclinical mastitis. So we should be doing our appropriate milking prep in the parlor that will help us detect changes in the udder related with clinical mastitis, but somatic cell monitoring helps us to find changes in the udder before they become a problem. And we may actually not find clinical mastitis in animals that have had subclinical inflammation and infections for a prolonged period of time. So monthly DHI test, or you can do routine CMT, California mastitis testing on a regular basis. The important thing for either of those mechanisms is that we're keeping records and monitoring that every month or periodically. I really like monthly. If you want to do it more than that, great. I would say less frequently can become problematic. It's just not often enough. So recording the results in a spreadsheet is really great because then we can graph that really easily and track trends over time. I love Excel spreadsheets. There's also, oh goodness, there's like the online version of Microsoft. It's called Sheets, I think. It's just on Google Drive. So you don't actually have to pay for the Office suite to be able to utilize a spreadsheet. You can just use the Google suite and they have spreadsheets on there. That's also really nice because you can just share that spreadsheet with your veterinarian and they can look at it over time as you keep entering data. And so they can see those changes in real time. We also want to look at a couple of other key performance indicators in regards to somatic cell counts over time. So our new infection rate, our cure rate, and somatic cell count at first test after freshening can be really eye-opening for identifying where problems are arising and why we have elevated somatic cell counts in our farm. The percent of herd with chronic infections is also really important to know because those are animals that are probably not going to be very responsive to antibiotics and are definitely contributing to an elevated bulk tank somatic cell. So how do we calculate these key performance indicators? And this is stuff that I have dealt with on the bovine side, and then these are kind of my personal translations into the goat dairy side. So I use a limit of 400,000 cells. If you want to change that for your personal benchmarks, that's totally fine. 400,000 is kind of a number that I pulled out of my experience, basically. So to calculate our percent of new infections, we're going to take the number of goats that were below 400,000 cells last month, and they're above 400,000 cells this month, and we're going to divide it by the number of animals in the herd that are currently lactating. And then you multiply it by 100 because it's a percent, and we all got through elementary school math, right? And so in cattle, our goal is to keep that number below 8%. I don't really have a lot of metrics on these KPIs in goats. So I think it's important to provide the perspective from the bovine industry, but I expect that that number is going to be significantly higher on a lot of goat dairies. And so I think this is where farm level evaluations can really be helpful. So if you were at 30% new infections last month, let's see if we can get down to 25% this month and start chipping away from there. The percent cured is the number of goats that were above 400,000 somatic cells last month, and now they're below 400,000 or whatever your benchmark is this month, and then divide that by the number in the herd and multiply by 100. Again, in cattle, the goal is to be greater than 35% animals cured in a month. And then our chronic percentage, we are going to look at the number of animals that have been above 400,000 somatic cells for the past 2 tests and divide that by the number in the herd. There's not really a set benchmark for that in cattle, and I think the cattle benchmarks are also kind of arbitrary. But obviously we want that number to be as low as possible, right? I think that's all. In cattle, just for reference, the benchmark that we use instead of 400,000 cells is 200,000 cells to dictate that cut point. So just a little bit of difference there. If you go and read about this on like Merck manual or something, the numbers are going to be a little bit different, but I've tried to adjust for dairy goats. Any questions on that in the room? Okay, so let's talk about clinical mastitis in identification. I alluded to this earlier, but milking prep is really important. How on earth can we know if the animal has signs of mastitis if we don't put our hand on the udder? You're going to know because you can see her terrifically inflamed and swollen udder, or if she's nursing kids, they're going to be skinny and hungry. Or she's going to be systemically ill. Those will be the ways that you'll figure out she has clinical mastitis without touching her. And in all of those scenarios, the vast majority of the time, you could detect that disease process a lot faster if you just got your hands on the udder twice a day when you were milking your animals. So we're looking for redness, swelling, heat. You will notice that even through gloves. An inflamed udder, you can feel it through the gloves. Pain, you're going to probably notice that first. The animal's going to start trying to kick when you go to strip the milk out or put the machine on even potentially. And so that could be an indicator, not just that she's having a bad day, but that her udder is painful and needs to be addressed. Again, looking for abnormal milk, so color, texture, volume, smell sometimes we can notice as well. So all of these things, 5 seconds to squirt a little bit of milk out, you can learn a lot about the health of your animal's udder. Again, if you have a production system where you allow kids to nurse, you'll probably notice that they're skinny and hungry, and potentially that one side of her udder looks a lot fuller than the other because the kids have been nursing off the unpainful side and the infected side is blown up huge because no one's drained it lately, or since the last milking anyway. So once we've discovered that we have a mastitis issue, either because we looked at our key performance indicators after we did DHI tests and we found all of our new infections, or because we identified someone in the parlor based on our handy dandy milking prep routine, we want to collect a sample of that milk and have it cultured so we know what kind of pathogen it is. There are some pathogens that tend to respond really well to the antibiotics we have available for intramammary treatment. And there are some pathogens that you can give them antibiotics until you are blue in the face and out of money, and they are not going to respond. So collecting an aseptic milk culture from the halves that are infected is really important. We want to make sure we do our normal milking prep before we collect the sample. And then before you put the machine on, after you've done your wiping that pre-dip off, you need to take a clean, fresh alcohol swab. It could be a cotton ball soaked in rubbing alcohol. It does not have to be something fancy you purchased at the store. You're going to clean the end of that teat really, really well. And when you look at that swab after you finish cleaning, that swab needs to be clean. If the swab is still dirty, you need to get a new one and go back and scrub the teat again. Once you are comfortable that the end of the teat is very nice and clean, you're going to, by not touching the end of the teat, milk a little sample of that milk squirt a few squirts away first, do your strips, and then put a couple of ounces of milk. It doesn't even have to be a couple ounces. A small volume, half an ounce is fine, of milk into a sterile sample container, and then make sure that you close that up. When you are holding the sample container, it's really helpful to hold it at a 45-degree angle and then squirt the milk like that, instead of holding it straight up and down, because if there is debris on the udder itself and it drops into your tube, your collection tube, you're going to get a contaminated sample, and that's a waste of your money. And you're not getting a good answer for your animal. So collecting an aseptic culture sample is really important. And then we only want to be treating bugs that are susceptible to pathogens. So in dairy goats, a lot of what we're seeing is non-aureus staphs, and most streps are also going to be pretty susceptible. Things like Staph aureus, even if you read on the label of the mastitis tube that it says it's approved for treating Staph aureus, that's in a petri dish. You are not going to cure Staph aureus mastitis by treating it with antibiotics intramammary or even systemically probably. It's just too good at holding itself up in the udder, walling itself off, and keeping antibiotics out. So non-aureus staphs and streps are the easiest things most likely to have successful treatments. You really need to work with a veterinarian on developing specific protocols for your farms, not only with regards to treatment, but also how we're going to manage contagious pathogens like Staph aureus, Mycoplasma, or Strep dis, environmental pathogens that are not going to respond very well to antibiotics like E. coli and Klebsiella. And then I always get questions about Pseudomonas. At least once a year, someone sends me a culture and sensitivity of a milk sample that is positive for Pseudomonas, and it's resistant to everything, and they are losing their minds because what on earth are we going to treat it with? Unless the goat is already dead or actively dying, I don't believe that Pseudomonas is infecting that animal. In a clinically healthy animal, which most of them are that I get emailed about, that is an aberrant result, probably because someone used water when they were prepping the udder. Pseudomonas loves to live in hoses and water and wet, dark places. And so if the animal is clinically normal with maybe just a small change in the milk volume or consistency, we really need to be looking at our udder prep and talking about keeping water out of the parlor as much as possible. Okay, so we've gotten through lactation, we've figured out how to prep our animals well, we're detecting clinical mastitis really nicely. Now let's talk about dry off at the end of lactation. So I have talked to plenty of producers, small ruminant producers love to kind of step their animals down in production instead of just stopping milking one day. And so you'll see farms that they cut back to once a day milking and then like every other day milking, and then they'll finally stop milking, and it's like a 2-month process. Physiologically, animals need the feedback of having a full udder to stop producing milk. If you continue milking them, even if you're stepping them down, it's going to take them even longer to dry off. In animals that are prolific producers, we need to be considering that when we're thinking about breeding decisions. So this is a tricky thing because we need to be making these decisions way before we're actually thinking about dry off for our herd. But if you have a line of animals that are really good at producing high volumes of milk and sustaining that production, I would encourage you to consider using those animals for extended lactation instead of drying them off at a really high production level, because as I'm sure many producers know, those are the animals that tend to have a lot of issues with mastitis and metabolic diseases during the dry period in the new lactation. So I agree, it is a challenge drying off really high producing animals. And I think as much as possible, we should be trying not to dry off high producing animals. Get those premiums and keep shipping milk to your processor when everyone else is drying off animals. So this does take quite a bit of planning, but I think it's really important for animal health and milk quality. So in the animals that we decide we are not going to milk through the winter and we're going to dry them off and prepare them for their next lactation, we have 3 different options. We can not treat them at all, and there's plenty of people that just stop milking their goats, and that's it. And they go in the dry pen and don't get touched for 2 months. Then we have another option of blanket therapy, where we are going to treat every animal in the herd with antimicrobials in the udder. This is also very, I wouldn't say commonly done, but also certainly practiced with small ruminants. Much more common on the bovine side, but I think it's gaining popularity on the small ruminant side as well. And it can be really helpful for mitigating subclinical infections in the udder that are present at dry off, but we haven't detected because she's not showing signs of clinical mastitis. It's not going to prevent infections during the dry period. Those drugs don't last long enough in the udder. They're not sitting there for 2 months. The body metabolizes them and breaks them down, and they disappear actually pretty quickly. There's also a risk of contaminating uninfected halves when we're inserting the tips of those applicators into the udder. So we really need to be really cautious about our cleanliness. If an animal kicks when you're trying to insert that lovely little tip into her teat and the tube winds up on the ground, really shouldn't be using that teat. And that's a really tough pill to swallow as a producer, because that's money you're throwing away right there. So we really need to be as clean as we possibly can be when we're using dry treatment, and only inserting the very tip of the applicator into the teat canal to infuse that medication, not the whole big long part tip. So it can be helpful, but there are also definitely some potential pitfalls with blanket therapy. It's a lot easier to manage a farm with blanket therapy, because you know that every animal that freshens is going to have a certain withhold before they can start going into the tank. And we should be keeping animals out of the tank for the first 24 to 48 hours anyway, because colostrum production is happening at that time, and colostrum is not considered normal milk, so should not be going into the saleable milk supply anyway. The final option, and I would say the best, the most judicious use of antimicrobials, is selective therapy, where we are targeting animals to be treated with antibiotics based on either their somatic cell count or the number of mastitis incidents that they have had in that lactation. I recommend using more than 2 as your cut point, or if they have had mastitis within the past month prior to dry off. There are a lot of different ways to do it. Again, this is a time where you can work with your veterinarian to decide what criteria you want to use on your farm. These are just a few of the things that we have seen on the bovine dairy side that I think do translate to the small ruminant side. So this is a great way to minimize antimicrobial use to animals that are most likely to benefit from that use, without running the risk of contaminating those uninfected halves, but also is really tricky to manage, because now you have to handle treated animals differently than untreated animals. And anyone who has worked with goats knows they are very good at getting out of their designated pen. They're good at removing leg bands. And so identifying these animals over the course of a 2-month dry period can be a challenge. And we need to make sure that we have several different checks in place for preventing treated animals from being milked into the saleable milk supply. So pros and cons to everything, but you need to select what is best for your farm and your animals. Okay, drug use records. I kind of talked about this at the beginning. I probably should have moved this up there with that slide, but it's really important. Anytime we're using antibiotics, not just at dry off, but anytime that we're logging all disease incidents. So if she had pneumonia 3 times this lactation, we should be documenting it every single time. Same with mastitis. And when we are documenting antimicrobial use, we should be logging what disease we used it for, and then all of these other things. Animal ID, the drug that we're using, the dose, how long we're treating them for, the route of administration, and then, as I said, the withdrawal time and the date that they are clear. Those should all be really clearly documented in whatever record system you are using. I think that's pretty simple. Don't have much more to say about it. It is really hard for producers to remember or find the time to actually do this. So I will acknowledge that, but it is very important to make sure that we are keeping drug residues out of our saleable milk supply. So, okay, just a couple more notes on equipment-based factors, and I would like to make the disclaimer that a lot of this information comes from Dr. Paul Verkler and his work with Whitney and the team here and the surveys that they did. So I am not going to get into the depth that Paul got into, but just kind of highlighting some of their findings here. This first aspect is actually something that I have dealt more with and haven't talked to Paul a whole lot about, but equipment sanitation. You know, we spend all this time talking about udder sanitation, but we also need to consider the fact that we need to be using clean equipment. And this is especially challenging for farms that are either hand milking or bucket milking, because we need to be cycling our wash water for at least 5 minutes. in that second step where you're using the chlorinated detergent, it's really hard to cycle water through a single bucket milker, right? So there are some farms who've actually rigged up a pump system using like an aquarium pump in a 5-gallon bucket to just keep that water cycling through their bucket milker. I did create an animation of that at one point in my postdoc career, and I really should find it and put it in these presentations because it can be really helpful for illustrating. But most goat farmers are pretty creative and they could probably find a solution. But it's really important to highlight we need to be focusing on water temperature. So that first warm water rinse really does need to be between 100 and 110 degrees Fahrenheit. If it's warmer than that, it's going to be denaturing the proteins in the milk, and we're going to get residues. If it's colder than that, you're going to get milkstone because the fats in the milk are going to start congealing and sticking to the sides of your equipment. So temperature matters. Then when we go through and use that chlorinated detergent, again, we need to be cycling for 5 minutes, and that should be a hot rinse. Another challenge we see with bucket milkers is keeping water temperatures above 120 degrees while it's cycling for 5 minutes. That's really hard to do. I don't have a good solution for it, but do your best. We need to make sure that we are starting with that water up towards the 135 degree point so that then when it's cooling off during that cycle period, we've got some wiggle room there. Another warm water rinse, and then using a cold acidified water rinse for 2 to 3 minutes can help to neutralize the chlorine residues from our wash and prevent milkstone residues, and also can help prolong the life of those rubber parts, because if they just sit in chlorine all the time, they're going to break down a lot faster. Finally, we should be sanitizing. That should be chlorine, not clonine, sorry about that, based sanitizer with, again, a warm water rinse, 100 to 110. And then most importantly, not most importantly, but very important, we should be drying everything. Bacteria that we deal with in the udder loves like warm, damp places, right? Like the udder is a warm, damp place. So if we let all of our equipment sit in damp places or just soak until the next milking, that is a ripe environment for bacteria to grow. So everything needs to be laid out to dry or left hanging to dry in between milkings. So I will say it is challenging, especially for smaller scale dairies, to buy appropriate volumes of chemicals. Most chemical sales groups are trying to sell you a barrel of something, right? And that'll take you years to get through when you're milking 10 to 20 animals. So what I have talked with some of my clients about is like buying products from their local dairy, if they're able to buy like a smaller amount from the dairy farm itself, or just working with suppliers to find a product that is sold in a smaller volume. But it's really important that we're using chemicals that are specifically designed for milking equipment and that we're using them at the designated concentration. So it's not like a more is better type scenario. We really need to be cautious about what concentrations we're using. Also bleach, like household bleach, not designed for milking equipment. Please don't use it to sanitize your milking equipment. I can't tell you how many farms I have been on. They're like, yeah, we just soak it in bleach. Or we make up a bucket of bleach water once a week, and then we dip our milking equipment in it at the end of milking. Bleach is easily deactivated by sunlight and organic matter. So keeping a bucket of bleach around is basically just water that smells clean. It's not really doing you much good if you're using it repeatedly. That might be a trigger for me, the word bleach. Yes. This is specific to milking equipment, not just goats. I just like to highlight with this the challenges that especially like bucket milking farms face. Also, farms that hand milk should also be sanitizing and cleaning their equipment, like the buckets they're milking into, and monitoring everyone should be monitoring their equipment to make sure that hoses aren't cracked. I think I talked about this on the next page. Yeah. So cracking of hoses, discoloration, the the residues that tend to form on buckets and things like that, that's a sign that you need to replace that piece of equipment. It's not put some sealant on it or try and scrub it off. It's buy a new one, okay? We should be changing inflations and hoses at least at the beginning of lactation for herds that are traditional producers where they start milking in the spring and they dry off in the winter. For herds that are milking year-round, every 6 months. And that's bare minimum. So more often is not wrong. On most bovine dairies, they're replacing inflations monthly. Obviously, those inflations are getting a lot more use, so it's really hard to translate between, milking a couple thousand cows and milking a couple head of goats, but I just want to put that in perspective. It's not use it until it's cracked and you can't possibly make it work anymore. These should be regular maintenance things. And documenting when maintenance is performed is really important. So writing it on your calendar, first of the month, we're changing inflations. June and December, we change inflations the first of the month. Change the hoses. And then make sure you're initialing next to it when it actually happens. And probably write the date too, just in case it maybe doesn't happen on the day on the calendar it says it's supposed to happen. But documentation is really important. We should also be monitoring equipment, like I said, for residues, cracking, discoloration, and then abnormal function or dysfunction. If you know that claw number 3 on the left-hand side squawks every time it's put on a doe, even though you replaced it 2 weeks ago, you better be looking at that claw and figuring out, or that inflation and figuring out, does it not squawk if you put a new one in? If that's the case, well then guess what? You got to put a new inflation in. Or is it installed improperly? But it's not just a hold it up against the udder for the whole milking to keep it from squawking type scenario. If it's not functioning normally, even if it's brand new, you need to address that. Okay, equipment monitoring. This is Dr. Verkler's area of expertise, so I am just going to touch on it. And I'm happy to chat with people more in depth in consultation with Paul if there are questions about this stuff in particular. So we should be having at least annual evaluations of regulators, pulsators, and vacuum pump levels. There are some farms that have never had these things checked in their entire functioning of the history of their functioning. Whew, man, sorry. Getting towards the end of the presentation, getting a little tongue-tied. But checking our equipment levels, even if we believe everything is functioning normally, is really important. If nothing else, it gives us a baseline for where your equipment is at today. But more often than not, even on the bovine side, we will find something that needs to be tweaked. A lot of my dairy goat producers have maybe not brand new equipment. Maybe it's a little bit jerry-rigged. Maybe we're piecing things together from a few different previous setups. And so, I've seen farms that are operating on two different pumps that neither of them function at full capacity. And we're just kind of trying to nurse things through. So we really should be doing annual evaluations of how our equipment is functioning. Also, trying to get service from dealers absolutely is a challenge. They hear the word goat and they go, oh, I don't know anything about that. A lot of times the issues are so profound that it really doesn't take a rocket scientist. If you're familiar with the equipment, you know how it's supposed to be functioning, and they can make adjustments. Even if it's not 100% perfectly fine-tuned for goats as opposed to cattle, it's going to be a heck of a lot better than it was. So really encouraging our dealers and our service personnel to come out and make adjustments and work with you is definitely a challenge, but I think can be rewarding once we start making improvements. All of these things can impact our milking efficiency and capacity and sometimes even pathogen transmission. So I don't want to understate the importance of maintaining equipment properly and understanding where our production or where our equipment is at with regards to capacity and functioning. And bacteria can grow inside equipment too, which is another reason that I say we need to be changing our hoses and our inflations and all of that stuff pretty regularly and making sure that it's clean and sanitized after every milking. So in summary, Goats especially are prone to physiologic influences in somatic cell count and fluctuations over time, but we absolutely still have room for improvement as an industry. Milking hygiene is imperative to making these improvements, and mastitis detection can be challenging if we're not prepping udders appropriately, which does tend to happen on goat dairies especially. Records are absolutely necessary to support milk quality initiatives and avoid residues in the food chain, or in the saleable milk supply. And equipment and cleanliness and maintenance is also absolutely important for maintaining udder health and improving milk quality. So with that, I will happily take questions. You can also feel free to email me.
I understand the importance of why you would want to culture before treating. And I'm wondering I guess I have the impression that in goats, mastitis can elevate to or escalate to being systemic more quickly than in cows, and that turnaround time, how you recommend producers work with their vet on farm culturing, send it out to a lab, and does that give enough time by the time you get the results back and treat? Yeah, what you think about that?
Yeah, that's a good multifaceted question, so you might need to remind me if I miss any parts of it. Okay. As far as goats being, we'll say, more dramatic about mastitis, that could be true, but I also think that we as an industry don't do as great of a job at mastitis detection. So by the time we find it, the goat is further along in the disease process and probably sicker and getting sicker faster. So I'm not sure how much of that is an artifact of our ability to detect it and how much of it is truly the goat drama factor, which is absolutely a thing. Also, a great point, it is certainly reasonable that farms are not able to carry out culture-based decision-making on a day-to-day basis. But I think a reasonable goal is to understand the pathogens that are common on your farm. And so still using culture and collecting cultures regularly to determine, what types of things you have, what types of bugs you have infecting your animals on a regular basis. And certainly, animals that are systemically ill, we need to initiate treatment before you get a culture result back, even if that's in 24 hours. So yeah, I think there's a give and take with that, but just the concept of routinely culturing cases of clinical mastitis or animals with new infections that we find on our somatic cell testing monthly, I think is a thing that we're not currently doing on most of our goat dairies. And it's kind of the low-hanging fruit that we could be doing a lot better job of antimicrobial use, judicious antimicrobial use, and also just understanding what pathogens we're dealing with. Did that answer your question?
Yeah, definitely. Okay. Thank you.
There's a couple questions in the chat. So the first one is, are there any special considerations for silicone inflations in hoses compared to rubber?
That's a good question. My understanding is that they tend to wear out a little bit faster. But as far as cleaning and sanitation, not to my knowledge. But again, I would defer to the information on the package. I'm not sure if they had a specific aspect that they were wondering about with the differences there, but.
Jeff, if you want to unmute, if that didn't answer your question, feel free to.
The silicone seems to last a lot longer than the rubber. Okay. And I was wondering if you clean it in some other way. I've seen the rubber deteriorate faster than the silicone inflations.
Yes. Okay. Sorry, I had those confused in my brain. Yes, the silicone does tend to last longer. I would still advocate for pretty regular replacement, but the cleaning routine should be the same regardless of which product you're using.
Thank you.
And then the second question is, can you explain calibration of milk testing equipment for goats versus cows at diagnostic labs?
That is a very broad question. Like somatic cell counting equipment?
Michelle, if you want to type or unmute, yes. She said yes, somatic cell counting equipment.
No, I cannot explain it. I'm sorry. It really just depends on what type of equipment you're using. Is that Michelle from the DHI? I think I know that, Michelle. I think it depends on what type of equipment you're using. That's also not my area of expertise. Somatic cell counting we do somatic cell counting at our lab with an automated reader, but it's a very, very small component of what we do, but I'm happy to help dig into that a little bit further. There are some good papers out there for looking into that. I just don't know off the top of my head.
Okay, thank you. Anybody else in the room have a question?
Yeah, I have two questions that are not really exactly related, but one is whether or not you had any general, kind of benchmark at all for SCC in sheep compared to goats. And then the other one was if you have any direct experience or thoughts about the Vimco mastitis vaccine that's been approved for goats, at least in the US, but I know some sheep people that use it too.
Yeah, those are two great and a little bit loaded questions. Shout out to my dairy sheep people. So when I say that we are lacking data with dairy goats and that makes it hard to benchmark, I would amplify that comment by about 500 for the dairy sheep world. It is such a small niche thing here in the US. So setting a benchmark, I don't know that I could give you a really good one. I just haven't worked with enough sheep dairies yet, and I don't want to be pulling numbers out of thin air. But I can absolutely help connect you with people who can give you some more insight on that. The Vimco vaccine. I also do not have a lot of personal experience with it. What I can tell you about it from the scientific perspective is that it is labeled to help prevent clinical signs associated with infection of Staph aureus, and I think there's some claims for non-aureus staphs too. It's not preventing transmission. So I think we could still see challenges over time with those pathogens being transmitted in the farm and causing damage, subclinical damage to the udder. And I think it could be a Band-Aid in the right situation. But it's definitely not something that I recommend people include in like their standard vaccine protocol for dairy goat or dairy sheep production. And I think just one more note to add, things like vaccines and antibiotics, they're all, for the most part, they're Band-Aids for management challenges, right? Like a lot of times when we say, oh, I just need to use a different antibiotic or give more or, whatever, it really probably goes back to a problem that is more difficult to address, but is going to get more to the root of the problem in that we need to make management changes.
Do we have other questions in the room?
So I have more experience with bovine dairies. I was wondering, I know there's a lot of precision technology used there to monitor health and stuff. And what do you see the future in precision technology in like small ruminants?
That's a great question. Well, good luck getting them to wear any of the monitors. Maybe like the chips or whatever that folks are starting to use in like the ear tags and things like that. I think that's going to be a big challenge though, is just getting them to keep it on. I know there's like rumen boluses in small ruminants. So those would definitely be challenges. I think the biggest challenge is going to be getting the equipment calibrated to small ruminants, and that is going to take a drive that probably comes from outside of the companies that are developing them. As with most things in the small ruminant world, there's just not the money or the support there to develop those types of things on a large scale. So I think there's a lot of challenges to that, unfortunately.
Thank you.
I've never used a microphone, so I'm sorry if it's really loud. So back to when you were talking about drying off periods for the high producing animals. If you end up like doing year-round production, I was just curious if then you have to start worrying about colostrum for kids. And then if you do recommend giving an udder break for them, and then how to do that if they're that high producing animals.
That's a good question. I should clarify. So when I'm talking about extended lactations, that means you are not breeding that animal. Yeah. Yeah. So if you're going to do an extended lactation, then you will just choose to not breed that animal and therefore not have to dry them off. If the animal is pregnant, you absolutely should be drying her off regardless of her production levels 60 to 90 days before she's due to kid, to give that udder time to involute. So I'm sorry about the confusion. Thanks for, no, it's okay. Thank you for noting that.
We have a couple more questions online. Do you recommend using different pre and post dip solutions such as iodine pre and chlorhexidine post?
No. I mean, I'm a keep it simple kind of person, and I haven't seen any benefit to doing those things, and I haven't found any literature that documents a benefit. So I think as long as you keep your dip cups clean, and you're emptying them and cleaning them after every milking, that's probably more important than getting fancy with what products you're using.
And then how long post kidding would you suggest holding milk before going into the bulk tank? I've been told 4 days by producers, not just for colostrum, but somatic cell count as well.
You should talk to your vet. You can also use, if you're worried specifically about your CMT or about your somatic cell count, you can use a CMT and test animals daily, or at each milking if you really want to figure out when her somatic cell count starts to drop and when your CMT scores are going back towards trace to none. And then that would be an appropriate time to put her back in the tank.
And then I have a question. How long does it take the teat end to close in goats compared to cows?
I don't know. Okay. That's a great research project for a graduate student.
Yeah.
Oh, no.
Thanks, Michelle. That was great. Follow up on the CMT. Do we shift the scale a little bit? Like, do people shift the scale a little bit and say, ones are, I mean, I guess a trace is 400, or, I guess a one is 400,000 anyway. So, right. So.
People do shift the scale, but I argue that it's unnecessary because the CMT works by lysing the cell and then the gel forms based on the DNA material present. Yeah, nice. So that shouldn't actually be different, shouldn't be that different based on cattle and sheep because the milk vesicles that we find in goats, it shouldn't be different between cattle and goats because the milk vesicles that are formed in goats don't contain as much DNA material as an actual cell. Yeah. So my argument is actually we probably should just keep the scale the way that it is.
Yeah, that's cool. That's what I was wondering because it binds the DNA, not cells. Yeah, so yeah. Cool. The second question was, is there much internal teat seal in use in goats?
No.
Yeah. Have people thinking about it or should we be thinking about it? Yeah.
I have not worked with any farms that are interested in using it. Yeah. Gosh, it's just such a tricky business. Yeah, I mean, getting those applicators into the goat's udders in the first place is a real challenge. And on the backside, my first projects as a postdoc were dealing with internal teat sealant in cattle, and that stuff can shed for weeks getting it out of the udder. And so especially when you're talking about cheese production, there's a paper out there on cattle that talks about finding little spots of bismuth subnitrate, which is the active ingredient in teat sealants, in cheese. Yeah, it's black spot defect. And so especially in an industry where so much of the product goes to cheese production, I don't know any farms that are interested in playing that game. Yeah. Again, haven't seen it. Might be. I would certainly advocate for that before I advocated for the internal sealants. Yeah, I think there's just a lot of work to be done with the external sealants, and I would love to see some more products brought to the market because I think there's a lot of room for that for our producers. I think it could be really beneficial.
No more online. On the European side, there's a fair number of approved systemic treatments, mastitis treatments type of thing, right? And so like in your PhD, did you do any work with systemic therapy and thinking about pharmacokinetics, pharmacodynamics as systemic therapy in goats?
I did not do any work on that in my PhD. It was all intramammary. And it's a tricky business because the argument is, well, when there's inflammation, it makes barriers leaky and then stuff can get into the udder more easily. And, things with a high volume of distribution like macrolides or something like that can, so like a Draxin would be a macrolide, for example, or Oxytet. Should already be able to get into the udder in relatively high volumes, but there's such an unknown about how much of that actually happens, and the degree of inflammation impacts it too, which is really hard to quantify when you start looking at like solid research procedures. So that really hasn't been broached. There are certainly folks who advocate for systemic treatment for mastitis, but I think especially in cases of mild mastitis, we really need to be reaching for localized intramammary therapy first.
Sorry. I noticed on your udder prep procedure, you had pre-dipping before stripping, and I generally have done stripping before pre-dipping, and I'm just wondering why it was in the other order and why you'd recommend it in that sequence.
I'm not married to that. My mind can be changed. The reason that I like stripping before pre-dipping before stripping is because we start killing any pathogens on the udder before we open that teat sphincter. And I think it really depends on like how many animals you're prepping. If you're milking 20 animals at a time and you're dipping everyone and then going back down and stripping everyone, you get a lot more contact time and that effect is going to be amplified. If you have one animal on a milking stand, I don't think it really matters at all. Unless you are trying to be really meticulous because you have a contagious pathogen that you're trying to deal with. And then there's going to be a lot of other things that we want to talk about as well, but that might be one small thing that you could tweak. Some farms will also like dip, strip, dip. There's a lot of wiggle room. So yeah, that's a great question.
Can I ask you a question that you probably don't have an answer for?
Yeah, of course.
What do you think the letdown time is for goats compared to cows? Because this is something that came up in the work with Paul and people prepping udders versus just putting machines on, because that's been the way that it's been done in Europe. And Paul coming from a cow background, like that's ingrained in us, right? Is that we need that 60 to 90 seconds from first touch to when that unit goes on. But do we have any idea what it is in goats? Has anybody done that research?
I have seen one study that looked at milk letdown, and it basically claimed that goats have 2 waves of milk letdown. I think that's actually bimodal milking with inappropriate prep. That would be a super fun and easy project to do. But I mean, have you ever watched Goat Kids Nurse? Does anyone watch Goat Kids Nurse? They don't just like sit there and like, take the milk. They're punching the teat with their heads. You can't tell me that's not stimulating letdown. Same with calves. I mean, they're nudging the udder as they're drinking. So I absolutely think that is a really valid thought process, and that I really think there is something to milk letdown and udder prep helping to stimulate efficient milking. And I would love to help someone do that project. Wink, wink, nudge, nudge.
He did, yeah. So we did collect lactocorder data, and we did see some bimodal milking on some farms, but it wasn't consistent across. Yeah, I haven't looked at that data and how that would compare to how that farm prepped udders. But yeah. Paul's thought was, because they're different from cows, right, where 80% is cisternal milk and 20% would be under oxytocin, that maybe they don't need that same prep time. But We don't know what it is, right?
Yeah,
Like
it's-
most things with small ruminants.
Yeah,
We don't know.
and some folks will argue that they actually hold milk back on purpose because they're multiparous usually. So it's okay if you have solid, initial milk letdown if you're only nursing 2 offspring. But if you have 3, 4, 5, like we do see in sheep and goats, then yeah, maybe you do need to be holding some of that milk back and letting it down later. Yeah, I think you'd probably need a crossover design type study to look at like the 2 different methods of milk collection, prep versus non-prep. But again, I think it'd be relatively simple to do.
And while there's a bunch more management factors that might influence it, if they did do T10 scoring on these goats and then the farms with higher proportions of bimodal things and that sort of stuff, there might be some relationship there, right? But you'd also have to have, like, how many farms had automatic takeoffs, right? And
Yeah.
right, we're taking, right, for looking at the relation, well, like these things in relationship to T10 health. Yeah.
This is the challenge with applied research on 16 farms with different management styles, right?
Yeah, another reason that we should be on farm once a year, looking at, and those are measurements I didn't even include in my PowerPoint, but lactocorder and vadias and like what does our milk flow look like through the equipment. Yeah, I think we could learn a lot and be a lot more efficient with the way that we milk our animals.
Anybody else in the room have a question? Yeah, sure.
Could you expand a little bit more on pulsation rates? I think you talked about a little yesterday.
Don't you remember the part where I said that's not my area of expertise? So I think she would just want me to do the imitation of how things milk, how things nurse. So yeah, one of the points that I made during the graduate seminar yesterday was pulsation rates probably are a little bit different, or definitely are different for small ruminants than for cattle. And I know Fauna Smith out at UC Davis has some set numbers that she likes, and I couldn't remember them when I was putting together my presentation. But my argument for that was that when you watch a calf nurse, it's da, 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 da. They're sucking, they're prolonged sucks, they're taking their time. And then when you watch a sheep or a goat nurse, it's ba, 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 ba. And they're a lot faster with how frequently they suck. So yeah, I think that would definitely warrant some alterations there. But those exact numbers, I don't know. I know people have opinions on them, but I didn't include that in either presentation.
We have the recommended pulsator numbers from the.
Oh, yeah.
The recommended pulsator rate was 90, and the ratio was 60/40.
I think the ratio is 60/40.
Yeah, 60/40 was the recommendation from Paul for pulsation ratios.
Yep, ratio. And then the rate of 90.
Yeah.
Yeah. Cool.
Anybody else?
Well, thank you all so much. This has been really fun. I love how engaged everyone has been. Appreciate the opportunity.
Thanks for coming. Okay, so thank you everybody for joining us in person and online. If you all would be willing to take this really quick survey, you can scan the QR code, and I will also drop this in the chat for those of you online. As part of this project, we're really trying to build out a resource guide for small ruminant farmers. So we're really trying to find like who those people are and share those with networks so that we can try to support the small ruminant industry a bit more in the Northeast. So we would love it if you would be able to fill that out for us. And thank you all for coming.